Needle Pod, we're back. We didn't do the 3-2-1. We'll bring that back, but we are coming with breaking news. And I mean, all of these are pre-recorded. And I mean, we kind of have our cadence in our schedule. What's ironic is today, I mean, sitting here recording, our second episode just dropped on Spotify. And actually that topic, we were covering cringy things, but really kind of like bleeding, bruising, like adverse events, just people that didn't like needling and kind of how to mitigate that. So this episode, we're continuing on that train and we're going to talk about pneumos because honestly, whether you're an NFL fan or not, or whether you're a physical therapist who dry needles or not, guarantee you heard something about TJ Watt's injury, which happened over the weekend. And that's why, Ellli and I had to mic up and discuss. I made a quick post, but man, this thing is swirling on social media. All the mainstream, I mean, Sports Illustrated, ESPN, people, like this thing is a hot topic. And I mean, the headline is TJ Watt injured from dry needling, underwent surgery for a pneumothorax. So Ellli, what was your knee-jerk response? When did you see the headline?
I saw the headline. Someone sent it to me on Instagram and was like, have you seen this? What are your thoughts? And it was later on in the evening when I had a chance to kind of look at it and then reviewing kind of what you had posted as well of what the consensus was. My original thoughts are ouch to have something
Seriously.
that we're so passionate about have this negative lens on it. But then you have to kind of take into all the considerations about potentially what this scenario was that are surrounding it. And we know that it is one of the adverse events that can occur with dry needling. And so I didn't have that strong of a reaction other than like, what is this going to do for us?
Shit. Bad headline for needling.
Yeah.
Which I think we all feel. And I was the same. I mean, the irony for me is I was teaching an advanced course. It happened on Friday, so day one of a 3-day course here in Washington. And I mean, day one, we do the scapular region. I mean, it's an advanced course, advanced topics, advanced techniques, but higher risk things. And we talk about thorax safety and same. I mean, my watch was blowing up. I got no less than like 30 text messages and Instagram pings with the ESPN article. And I'm like, yeah, first knee jerk thing was like, shit. I mean, we know it happens. And honestly, there have been even, I guess, higher profile injuries, like the one that'll always come up. And unfortunately, this is now on the list for any like Department of Health hearing or, when it does come down to that scope of practice battle and the topic of safety comes up. Unfortunately, the acupuncturists bring up, an Olympic skier that was injured back in 2011 from a pneumothorax. And now here we have another one, 2025. So, I mean, shit, another bad headline. Plus, I mean, I'm from Wisconsin. TJ Watt played at Wisconsin. I mean, he's an all-pro player, but he's a franchise player for the Pittsburgh Steelers. So, I mean, if you're a Steelers fan, but just seems like a really good guy, and no one wants to see anyone injured, especially from dry needling.
Yeah.
But I mean, the N of one thing is tough. I mean, it's such a big headline, and it gets carried in all of these news cycles, but it's the percentage that's being inflated. So, I mean, we dive into it on advanced, but on every needling course. So pneumothorax, have you ever caused one? Like let's talk percentages for this. Like, I mean, I think we could say worst case scenario from dry needling is this. So what's the risk profile we're talking about here?
Yeah. So I've never caused one that I know of. I've never had patients complain of, chest pain following dry needling, especially around the thorax or, upper trap neck area. And if we think about back to our first episode of how many needle sessions I have done, it was anywhere from 20 to 30,000 needles, right? So just my own, again, N of one, never had it experienced in the clinic. It's 1 in 30,000, right? At needles. So
Yep.
less than 0.1%, right? So, and that's kind of what we see in the data too from a lot of our research out there is that it's anywhere from 0.0014% to 0.1%. So on average, about 0.01% of folks may have a major adverse event, which one of those includes pneumothoraces. So yeah, I've never personally experienced it or had any patients complain of that. I have a handful of patients in the medical field as well that feel really confident that our needles are, small enough where the trauma that it would induce in lung field may not be enough to create that sort of pressure gradient. But obviously, this is something that seems very correlated, you know? So, what about
Yeah.
you?
I remember, well, I mean, first of all, your point about other medical providers and their view of how concerned we are. We should be concerned. I mean, it has
Yeah.
happened, obviously, but yeah, I remember two interactions, one being a physician, and they're basically laughing, saying, "What do you think you guys are going to do with your tiny little needles, like around joint capsules, around the thorax?" And I'm like, "Well, I don't know. I mean, clearly this has happened."
Yeah.
And the second one was a military PT. And especially when we were kind of talking about, can we let go of a needle that's hovering around the thorax? He's like, bro, do you know how many pounds of pressure it takes to get a chest tube in on purpose, like in the intercostal space? Like he was trained in it, like medical, like battlefield type stuff. And he's like, you can let go of a razor blade and you're not going to cause like a deep penetrating injury. So I mean, those things
Yeah.
make me feel more safe for sure, but again, clearly it can happen. I mean, to answer your question, I also have 0 pneumothoraces that I have caused with patients that I'm aware of. Over 15 years almost of dry needling practice, I've had 2 patient phone calls, and they were both back in the day, you know, which again for me means maybe a little more aggressive pistoning, less e-stim. But I mean, patient called later that day or the next morning, said, yeah, I've been feeling really weird since that session. Like, you know, because pneumothorax is a part of my informed consent. So, I mean, I'm
Hmm.
sure either researched it or knew what it was. And they're like, you know, I feel like I'm having difficulty breathing, or like I feel really weird, a little lightheaded. And unfortunately, I mean, your heart drops into your stomach. Like, obviously, things
Hmm.
you never want patients to hear from a patient. And obviously, you never want to injure a patient. But both of them, I just had to say, some of what you're saying is not a normal dry needling response. And unfortunately, being a healthcare provider, I had to say, you know, if you're this concerned about it, or this is this concerning, you need to go to urgent care or GP, but like you need to go today and get checked out. That might include a
Hmm.
chest x-ray. I mean, the follow-up was both of them did go in. One of them, the physician wasn't concerned enough to do a chest x-ray, and maybe knew the patient because
Hmm.
basically felt that it was more mental anxiety, like more of an anxiety attack. So
Hmm.
kind of said, you know, see how it goes for a day or two. If it gets worse, come back. The other one actually did have a chest x-ray and no pneumo. So again, knock on wood, never happens. I think, again, you start talking about our sample sizes, and some of the data you said is big scale, like European, like, but physical therapists using needles. Then we have the boys study here in the US. But like, yeah, you get into the tens to 30s of thousands. Like at some point, you have to say the risk is approaching one of those sessions causing a
Hmm.
pneumothorax. And I mean, even HPSO, CNA, I mean, our liability insurer data, they have not seen mathematical spikes or statistical spikes in injuries by physical therapists since we have started
Hmm.
needling in more states with more patients. So I think mathematically, we do need to frame this as an N of 1, and really the overall risk of this. If you're maybe a healthcare provider that's nervous about doing dry needling, or maybe you're a patient listening not aware that this was a risk. I mean, we're saying dramatically less than 0.01%, and it's probably even lower than that. But, you know, statistically, you can't say 0.
There's
So
no
you,
risk. Yeah.
yeah, so you have to assign it a number, and it's less than 0.01.
Yeah, you
But
made
I
a
mean,
couple good points there too of like how we needle, right? There's different brands of dry needling under the umbrella of dry needling. And when you're treating very trigger point heavy, you're pistoning a lot. The more times you move that needle in and out of a muscle that's close to lung field, the more potential you have to interact with that more sensitive structure. And so I think if you are evolving your practice with kind of where things are going with minimizing pistoning, e-stimming a little bit more, you're probably going to mitigate those risks a little bit as well. And then looking at the anatomical research of how can we also mitigate these by propping different tissues and
totally.
taking some of that depth away or increasing the depth, I guess, for the lung field.
Totally.
So,
And I mean, what sucks is we have 0 info on TJ's injury. Like, basically, and they even make it seem like he didn't have a very active injury. Like, he wasn't on the injury report. He essentially wasn't potentially even seeking needling for an injury. I mean, it's kind of the realm that I live in, which is NFL guys do it, and it's just a part of their recovery routine, or even like for performance. So he went in, got needling. We have 0 data on even who did it, What's interesting, if you look at the Steelers' medical staff on the website, they must have a PT, but he must be a PT ATC because they don't have anyone listed. I have it up right here, listed purely as a physical therapist. They have,
Mhm.
excuse me, they have head AT, they have 4 kind of associate ATs, they have a team chiropractor, a bunch of physicians, but no one is just listed as I'm the team PT for the Steelers. And again, being in this NFL realm, I actually thought with the most recent collective bargaining agreement for NFL, I thought teams were required to have a PT, which is why I make the comment one of those ATs must be duly credentialed, must be a PT. But even with all of that, we have no idea who did it. And unfortunately,
Mhm.
we may never know. But yeah, what is your guess? I mean, how did this happen?
I was just looking up the scope of practice of athletic trainers because there are states that allow athletic trainers to needle as well. And in late 2025, athletic trainers were started needling in the state of Pennsylvania, which I'm assuming that's where it happened, right?
It said at the team facilities, so yeah, I think that's
Okay.
safe.
Yeah. And so um it says it's currently not authorized as an athletic training procedure under Pennsylvania Practice Act. But yeah,
And
so
unfortunately, that's another layer to this whole thing. I mean, it occurring in Pittsburgh, in
mhm,
Pennsylvania at this time. Unfortunately for physical therapy, there is a current bill sitting in committee. It was introduced a week or two ago to formally allow PTs to do it. It
mhm,
is not currently illegal. It is currently undefined. So this is not trying to say we can do it from not being able to do it. It's saying let's define what the statute is. But man, you have to picture that this headline is coming up at a really raw time in
yeah,
some
definitely.
healthcare committee, and you hate to think that again an N of one is going to sway a legislative body, but man, these are likely legislators that don't have healthcare education. Maybe they don't have any other experience with dry needling aside from a headline that their favorite football player in the middle of a playoff push got injured and had to have surgery from dry needling.
Yeah. Yeah, that's tough. Yeah, I think what's hard is like you mentioned, we don't have any of and like you said, we're never gonna know what exactly happened. And so we just kind of have to um take that with a grain of salt. You mentioned something earlier as well about consent. And so I think that's another thing, or like advising of adverse events that can occur with dry needling. And that's something that some people kind of glaze over too. They have it in their written consent forms and things like that. But I think one of the biggest things about getting both verbal and written consent and kind of talking through a patient of the procedure and what some major adverse events that can occur and talking about how rare they are, especially if we're knowing our anatomy and kind of using everything we know about anatomy and our needle handling skills to mitigate those risks. But I think that verbal consent and acknowledging that, because it was something that I saw in a headline or someone posted some sort of thing about, well, adverse events should be educated to people that are participating in dry needling or getting
For
dry needling.
sure.
And I'm like, well, duh, that should be something that
Yeah.
all clinicians are describing. And I think that's something that we get a little sloppy with sometimes. It's not just us as physical therapists, but all healthcare providers. Like we hand a packet to someone and say, here are the adverse events that can occur.
Yeah. And you touched on two different roads I want to go down. The first one is even on the course that I was on, I mean, people being trained in needling, they're trying to introduce this to their clientele for the first time. I mean, in Washington, these are folks that are finally going to be allowed to use it with humans. And I mean, the question from the clinicians came up of like, man, and I got some messages on Instagram as well of like, man, how is this conversation going to go when a patient comes in and says, I heard about TJ Watt. I would no longer like to do dry needling. I mean, how are you going to counsel? Because it's going to come up on your courses as well. How are you going to counsel those folks that are, as a provider, now going to have these uncomfortable conversations? Which I agree with you, they should have already been having if they brought up pneumothorax as a severe adverse event from dry needling in their informed consent. And I mean, you first need to be comfortable with that. But what is your script for now dry needling professionals that are going to have a pretty direct conversation about this because their patient saw the headline?
Yeah, so I don't know if my verbiage is gonna change much because 'cause I've been trained in, I'm gonna talk through what dry needling is. We use small monofilament needles and that there are some adverse events that can occur. Most commonly, it's bleeding, bruising, post treatment soreness. And, outside of that, there are things when we're interacting or when we're needling around lung field, we have the potential to interact with that lung field. Any needling technique around rib cage has the potential to interact with lung field. So I kind of also layer that into it because if they are getting things like injections for pain and things like that, they're already introducing needles around lung field if I'm treating that same area. And then I will tell them the risk is about 0.01%. And I do think that kind of brings that nervousness down a little bit. And then what I add is that I say, I know my anatomy extremely well. This is something I feel very confident doing. If it was something that I didn't feel confident doing on your body, I would refrain from doing that. We have a ton of other tools in our toolbox, and we can treat things without dry needling as well, even though I'm very biased and I love dry needling. So that's my typical spiel. And I don't know if that's going to change a ton now.
Yeah.
I do think it does. People are going to come in with more questions for sure. So you got to be ready for those.
Yeah. And I think what you said is you have your script, you have your confidence in that script. And I mean, mine's kind of similar of like, I don't go into it till after my evaluation. So my script,
Hmm.
quote unquote, is like, all right, Gladys, here's what I think is going on. I mean, either you're coming to me interested in dry needling or based on what I'm seeing, based on what I trained in, I think what's going to give us the most effective, most immediate, most profound results is this thing called dry needling. And then that's when I hand over the consent form. I'll give you a few minutes to read this. It talks about the risks, most severe risk of any needling procedure, which is part of my thing to the professionals of like any needling procedure means injections, acupuncture, dry needling. When you're using needles in this region, the most severe event is called a pneumothorax when a needle enters the lung field. And then that's my script. And I mean, if there's going to be deeper questions of like, yeah, that sounds horrible. Like I just heard of one the other day and ESPN.com. Like I don't want a pneumothorax. I think it's already something we've touched on is like the risk profile being so incredibly low. And I mean, we can just stop saying numbers right now and just say the risk profile is substantially lower than injections, even pharmaceuticals for sure, but pharmaceuticals even being NSAIDs, spinal manipulation. If you look at major adverse events and the percentage risk of those things, I mean, dry needling stands up really well, both as a mathematical number, but also as considering surgery or even narcotics. A major adverse event is truly death or like permanent disability or like permanent changes. Organ injury, pneumothorax, and honestly, to my knowledge, no one has died from a pneumothorax from dry needling. The risk is low, and the most severe, the worst potential thing is still much better than anything else. So I mean, maybe there will be more patients saying, "Yeah, I'd love to try something else first," being not dry needling.
Hmm.
But my soapbox is if you're at the point with that patient where they're considering an injection in the spine, in the chest region, medication, even being NSAIDs, or almost anything else in traditional healthcare, have that risk reward discussion at that point. I mean, it's better than the other options is the answer there.
Definitely. I like that point as well, kind of comparing it to what else they're going to get for treatment for those symptoms. So, yeah.
And unfortunately, we're bringing up any needling procedure, and you brought up other professionals, which is the other road I want to go down. Because unfortunately, obviously, the community that is stirred up the most and will be advertising this the most are the other needlers, being acupuncturists. And unfortunately, I don't know which version of the ESPN press release you read, but the first one was a bad look in every respect. I mean, he had surgery, whatever, caused by dry needling, but their only interview was Patrick Queen, who's a linebacker on the same team, and he basically said, I'm terrified of dry needling, that's why I do acupuncture. And then he basically read the acupuncture script of like, I like acupuncture because they have thousands of hours of needle training. They're not just trained in a weekend course. I'm not sore as hell afterwards, but man, that was the first release. So again, imagine a patient or anyone naive to this more nuanced conversation reading that. I mean, I will congratulate ESPN for doing, they did a revision the next day and they interviewed Sue Falsoni. I mean, a dry needling educator, pioneer, like very qualified to have this discussion where she's saying a lot of what we're saying, which is, when done properly, it's very safe. It basically carries the same risk as acupuncture, but But man, has this stirred up a lot of the like acupuncture versus dry needling sentiment.
Yeah, and that's the piece of the puzzle that's been a long-standing battle, you know? We've seen it in Washington and all throughout the US, so I'm interested to see what that opens up, what kinda cans of worms.
I mean, how long it hasn't been a week yet since this whole dropped. Like
5 days, yeah.
I have been fully engaged in social media battles on both. I mean, I made that post and that's obviously what prompted a lot of it, but man, just defending safety. I mean, everyone out there saying PTs are not qualified to do it. And like, man, we have so much data. And what really sucks, I made this point on, I don't know, Instagram or something, but what really sucks is like the people, even in our own profession, I mean, I won't say names, but we know who like the instigators on social media are.
Mhm.
They will always like diminish research supportive of dry needling by saying there's such high bias or there's small sample sizes, like blah, blah, blah. But man, when an N of one, when literally a single case pops up that makes their point that they can just talk about, man, PTs shouldn't be doing this. This is why, you know, we should be doing whatever, fill in the blank, other manual therapy, exercise, just educate, which for sure, do that stuff first. But how annoying. Like we have to notice the irony there.
Yeah, and I know we've already touched on it, but we don't even know if this was a physical therapist that did it, you know? And so
Man,
while it is one of, a major tool we have, so do other providers. And so it's hard to know.
yeah.
But yeah,
The
a
more
lot of
info we
finger
get,
pointing.
which again, I hope we do, but I'm not overly optimistic, would silence a lot of these discussions. And what's
Hmm.
fascinating, and maybe the best way to wrap up all the info we have right now, it's fascinating. He had surgery, obviously. I mean, and you have, which is a chest tube. I mean, first of all, it's not like an open surgery. They go in, remove the air or the fluid that accumulated. So it's a chest tube, which I mean is a serious procedure, but what's interesting not knowing info is like you have that when it is a large percentage, like a big injury, like there's a huge
Hmm.
separation in the visceral and parietal pleura. But part of me and some of the people on social media are asking, did they just go ahead with surgery for potentially getting him back sooner? And what's fascinating is, as of today, there's a potential he's going to play next week, which is crazy. I mean,
Crazy.
when it first happens, when you first hear that he has emergency surgery, you're like, man, he's done for the season, which
Hmm.
might still happen, but man, he might also be back this week. So I think more info on the procedure would be nice, but more info being, you know, as the water goes under the bridge and we're months or years down the road is like, yeah, it was a major injury, but he missed a week, like the most
Hmm.
severe injury, which is wild.
Yeah. Yeah. I think what's also good to point is like most pneumothoraces that have occurred with dry needling in the past have resolved on their own too,
Right.
you know? And
Yep.
so, like you mentioned, is this just to get him back playing sooner? Then yeah, that's something to just track. Yeah.
Yeah. And if you're a provider who needles and you want to read more about that, Gerwin, I forget the year. I'll post it in the notes, podcast notes, but Gerwin did a nice write up on a pneumothorax that he caused. I mean, kudos to him for publishing it. There's a video attached to it. He caused a pneumothorax doing a rib blocking technique during a needling course. And I mean, it was on his partner, his colleague, which was nice because he was also a physician and had access to a chest x-ray. So, I mean, the write-up is nice because it's both a cautionary, like higher risk techniques. I mean, rib blocking techniques are not something we teach at ICE
Hmm.
for lots of reasons, but that's basically one of them. But then the provider who was injured goes through writing up like kind of what he felt immediately, what he felt the next day. And then, yeah, like you said, there was no medical intervention. They just let it, I mean, conservative care meant they observed him. And, 2 weeks later, almost complete resolution, but on exertions, still some, I guess, some labored breathing, or I forget
Yeah.
how they worded it. And then full resolution 6 weeks later without any intervention.
Yeah.
Here we are.
Interesting. Yeah. Interesting topic today.
So who knows? I mean, if they release a ton of details, maybe we'll jump back on for a follow up, but I think it's something we need to tackle. I mean, I think even like we discussed, it's a topic not even all professionals, when they're being trained in needling, want to talk about, but you have to talk about it and you have to talk
Hmm.
about the safety data. You have to talk about how to be safe, how your training can mitigate those risks, and you have to be comfortable legally with the consent thing.
Yeah, definitely. I think that's good.
So
So go for it.
Well, I mean,
I was
unless you have
just
a
gonna
good,
start the wrap up. No, I was just gonna start a wrap up. I
yeah,
was
I
gonna
mean,
say,
that's what we need. We need a dismount.
well, if you guys are finding this podcast from Instagram, you already follow us on Instagram. But Paul, where can people find you if they are new to you as found us through the podcast?
So grab a pen. My physical address is, no,
My
just
social
kidding.
security number.
Yeah, I am at DPT with needles, all spelt out on Instagram. Otherwise, if you have ever taken an ICE course, you can get directly to me on the ICE app, or yeah, lots of places. I mean, at iDryNeedle, at dn.icephysio. What about
Mhm.
you? What's your preferred mode of communique?
I always answer messages on Instagram, so at Ellison_Melrose. And then again, if you find me on the ICE app, if you've been there, I will respond to direct messages there as well. That's really it. But I think that, and then where are we streaming all podcasts?
For now, it's on Spotify, and it's not called iTunes anymore. I think it's just like
Apple
Apple
Music
Pod.
or
Yeah.
Apple Pods. Yeah.
And I mean, we do have these handsome videos. So at some point, maybe we'll be on YouTube where you can see our faces. But for now, all the glam is for nothing because you can't even see us. You just hear our voices through your
Which
headphones.
is lovely.
All right, team. I mean, I
Awesome.
do want to wrap up. If you have any questions on the topic or you want more info, hit us up. Like Ellli just said, we do wish a speedy recovery to TJ. We do hope that this brings, some positive light in both training and scope of practice and maybe even professions coming together at some point. But thanks for tackling the topic with me, Ellli.
Yeah. Of course. Happy to be here.
We'll see you next time.